In our first story, we start with health. The Ministry of Health has confirmed that at least 33 people have so far died in the latest outbreak of the deadly pneumococcal meningitis. At a news conference on Monday, the ministry said it is presently using antibiotics to fight the disease as it works on getting the needed vaccines to deal with the current outbreak. Matilda Pomaga was there for Joy News and has filed the next reports.
The Health Ministry announced that 153 people have been infected in the Brong-Ahafo, Northern and Ashanti regions. The ministry at the moment does not have vaccines to deal with the outbreak and is alternatively using antibiotics as a form of treatment for infected persons. In a bid to contain the spread of the disease, the Ministry of Health has stepped up its campaign in the affected areas while it seeks support from the World Health Organization to handle the outbreak.
So this year, a lot of interventions have taken place already. Normally, for October, a health alert is sent to the health facilities to remind them that we are entering the season. So you look out for fever, headache, and neck pains. But as I told you, it is more profoundly done in the northern part of the country. So the clinicians are more alert. They can easily pick the cases. And also, the awareness creation is more in the northern part of the country. So those things have started already. The ministry has also sent some monies to the regions to support them in preparation. WHO does a lot. They produce the test kits. For meningitis, you need to be sure of the diagnosis. You can clinically suspect it, but you need to confirm. So there's the test kit that they call Pastorex. It's a rapid diagnostic test. And that one is purely provided by WHO over the period. So this year, you provided 6 packs. They were distributed, and that has been used in managing these outbreaks. So there are clear plans that has been on course, preparing us for this outbreak. But let me say that the burden exceeded somehow the expectation, because as I said earlier, Brong-Ahafo is not a typical location for meningitis. So suspicion is low, clinicians are suspecting malaria, and they get worse before they think it could be meningitis. That's why accounting for the high disease burden. But I think that with the heightened awareness, as I said, we expect that cases will be going up. With time, the cases will go down, and there will be no fatalities, and then increasing cases. But the threat still remains. So far as we are in the dry season, I think that we still have to keep working on our surveillance and effective case management.
The most pressing issue, according to the Deputy Minister of Health, is finding the cases early and ensuring that patients report early to the hospital for rapid treatment.
When we say that there is no cause for alarm, it doesn't mean that there is no problem. There is a challenge. What we are saying is that together with the districts, the region, ourselves, our partners like WHO, we have in place the elements to deal with the issue. Getting the cases to come out early, getting people to have the information so that if they have the symptoms and signs, they can come to hospital early. Once they are treated early, then we can get everything under control. Government is doing everything in its power to provide the resources to make sure that this is brought down in the shortest possible time. And we will urge you to continue to work with us, provide the messaging for this to be snuffed out at the earliest possible time.
The help so far from the World Health Organization includes laboratory equipment, which are basically test kits for the diagnosis of the disease.
We know there's a lack of information as to what you need to know about it, and so painstakingly we decided to do this. And so how would you know you have contracted the disease? And Matilda Pomaga has been reporting on the signs and symptoms and what all of us need to look out for.
In Ghana, the worst outbreak of meningitis, cerebrospinal meningitis, CSM, occurred in 1994 and 1996. It affected 17,000 people, leaving 1,000 people dead. According to the Ministry of Health, the present strain of the disease is not the normal one which the country is used to. The latest is caused by a bacteria known as streptococcal pneumonia. Fortunately, the new strain, although more deadly, does not spread as fast as CSM. Pneumococcal meningitis occurs when the bacteria invades the bloodstreams and infects the membranes protecting the brain and the spinal cord. Meningitis is a serious and potentially fatal disease. It kills 1 out of 10 patients. Pneumococcal meningitis is transmitted from person to person. The bacteria is spread through tiny droplets from an infected person's mouth, throat, or nose. For example, if someone with infection coughs or sneezes on or near you, you may contract the disease. People with symptoms and signs suggestive of meningitis, such as fever, headache, neck stiffness, should report immediately to the nearest health facility. The general public, especially those who live within the meningitis belt, such as the 3 regions in the north, Bronx, Ahafo, and Ashanti regions, are being advised to avoid crowded places, ensure enough ventilation in rooms, and prevent dryness of the throat by drinking more water. Cover your nose and mouth when you sneeze or cough. Avoid sharing personal products like spoons, toothbrush, cups, and handkerchiefs with others. Matilda Pomaga, for Joy News, Accra.
Meanwhile, the Health Ministry will procure vaccines for the deadly pneumococcal meningitis through sole sourcing due to the intensity of the outbreak in parts of the country. Health Minister Alex Segbefia revealed he gave a directive on Monday for the procurement of the vaccines to deal with the current outbreak. He was giving some answers on how the Health Ministry was managing the disease when he appeared before the Public Accounts Committee.
Sole sourcing is a circumstantial issue. The circumstances will dictate whether an item requires sole sourcing or not. So almost in most cases, or in some cases, there are issues which, even though you would go through the general process of procurement, may require sole sourcing. I've just had to do a sole sourcing for vaccines for meningitis, because normally that would go through a normal process, but because there's a potential issue happening, they have gone into sole sourcing because we've looked at those who have them in stock immediately in the country to get them. So I'm not sure that the question is a very general one, but if there are specific items that are required, I can ask the procurement officer for Ghana Health Service to...
Minister, you mean you give instructions for the meningitis vaccines on the sole sourcing without approval of the procurement board?
No, with approval of PPA.
Exactly.
Sole sourcing is part of.
So,
well, away from health, the Attorney General is being blamed for not enforcing recommendations for the prosecution of those accused of financial and other administrative irregularities in the Auditor General's report. Vice Chairman of the Public Accounts Committee of Parliament, Emmanuel Atani, is also warning that until the Attorney General begins to prosecute work of the Auditor General as well as the Public Accounts Committee would amount to nothing. Well, issues of violations of the Act dominated the Public Accounts Committee's hearing on Monday, following revelations that some 332 vehicles procured for the Health Ministry in 2009, and all these, valued at over 10 million cedis, were done without recourse to the procurement law.
Well, 2 dimensions. First of all, it could be that they do not appreciate the criminal implications of their actions. Because they might want to say that this is an administrative lapse. But as we've underlined, the law is so clear that you can go to jail because of an infraction resulting from your disrespect for the Procurement Act. The second of all, which I think is very serious, that we do not feel the Attorney General in these matters. Every criminal action is at the suit of the Attorney General. And therefore, if the Attorney General will not demonstrate to the whole Ghanaians that if you fell foul of the Procurement Act, I'm going to prosecute you, this impunity will go on.
But, I mean, going through a report, apart from the embezzlement, Procurement Act and violations of it quite pronounced in all the reports that has come before the PAC. I mean, my point is the understanding of the Act, you know, the issue here, as far as the application of it by the public sector workers is concerned.
It's not only that, it could be a veritable vehicle for corruption. You understand? Like sole sourcing and the rest of it. Handpick your friend to come and render a service so that you get your kickbacks and the rest of it. So what is the Procurement Act about? Probity, transparency, and accountability. And if you do not go by the Procurement Act, you know, that public sector corruption cannot be checked properly.
We have passed a law that says that even in an event you want to undertake sole sourcing, it must come under certain conditions. Clearly, what they have done doesn't fall within what sole sourcing, condition dictates.
It doesn't fall within that at all, and that is a very fair assessment that you've made. And it's all because they are not afraid that they'll be punished if they fall foul of the law. But if they know that somebody can go to jail, a maximum of 5 years for an administrative lapse or whatever you call it, the whole system will change.
Security has been beefed up at the Bewa Palace in Yendi in the northern region following threats by members of the Abudu royal family that they will have to use all means available to them to perform the final funeral rites of their late chief, Na Muhammadu Abdullahi IV. And the outgoing Interior Minister, Mark Wayongo, is also appealing to the two rival factions in Yendi, the Abudus and Andanis, to exercise a lot more restraint as government and the Committee of Eminent Chiefs also tried to resolve their grievances.
It will be recalled that at the weekend, the regional minister for the northern region assured the general public that security was being beefed up at Yendi and other sensitive areas. In fact, the Regional Security Council is monitoring the situation and then will advise government accordingly. In the interim, what the ministry is going to do is to appeal to the eminent chiefs to speed up work on the funeral arrangements and the roadmap for restoring peace to the area. I would also want to use this opportunity to appeal to the two factions to exercise restraint, because I know that the eminent chiefs have gone so far in restoring peace to the area, finding lasting solution to the area. So my appeal is that they exercise some restraint to allow the eminent chiefs to conclude their work. In the interim also, the Regional Security Council will continue to monitor the situation and advise government accordingly.
You are tightening security. Are you sending in more men?
That's the implication. If you are beefing up security, you will be sending more men and logistics so that in the event of an outbreak of violence, they'll be able to contain the situation.
Now, you say the Committee of Eminent Chiefs are intervening in the matter, but what sort of intervention are you looking at since the Abudu family last week expressed lack of confidence in them?
Well, it's unfortunate, but I don't know why they don't have the confidence in the three eminent chiefs. They have not yet come out with their findings, and I think it's to be premature for them to conclude that they have no confidence in the eminent chiefs. And that is why I want to use this opportunity to appeal to them to exercise restraint. When they come up with their recommendations and they are dissatisfied with those recommendations, then maybe they can let the public know why they are dissatisfied.
And the outgoing minister's appeal follows rise in tension in Dagbon, a community which has now seen some peace after the 2002 conflict between the two families, which led to the death of the overlord of Dagbon, Yana Yakubu Andani II. On January 11, 2016, the Abudu royal family in the Dagbon chieftaincy divide served notice to government and the Otumfo Mediation Committee that they would explore other alternative means to occupy the Bewa Palace to perform the funeral rites of their late chief, Na Muhammadu Abdullahi IV, if they fail to grant them access to the palace by close of Monday, January 25.
We refuse to condone the uncustomary and illegal recognition and prestige bestowed on the Kugana by the Santihine Committee and the President. The fate of our great kingdom cannot be bound to the whimsical delusion of a usurper. The family is therefore decided not to cooperate with any decision on customary matters that does not have the blessing of the Gushago regent. We can only achieve lasting peace in the kingdom through the spirit of cooperation, compromise, and give and take. We in the Abudu family have demonstrated these qualities throughout the mediation process. The least we expect is commensurate reciprocity. but not outright indignation.
And following this, there have been triggering reactions as over the weekend, the Andani royal family also vowed to protect themselves from any attack from the Abudu royal gate. The Andani family said it is ready to engage in another war over the Abudu's notice to forcibly enter the Gbewa Palace to perform the final funeral rites of their late regent, Na Muhammadu Abdullahi IV.
The royal family has been adamant about apologizing for the crime. Neither has the family ever shown any remorse whatsoever, has gone out by their latest statement in which they are threatening more fire and brimstone. But we serve notice that if they start a violent confrontation this time, they will be embarking on a suicide mission. We of the Andani family wish to convey to Dr. Nantoma Mama and his extremist killer in the Abudu royal family. We are ready for a confrontation. To this end, we ask the security forces in Yendi to take notice of what is happening.
And checks at the Minsha Palace suggest authorities are upset about the latest outbursts between the Abudu and Andani Gate over the protracted peace process. Sources already describe the development as unfortunate because it comes as the Committee of Eminent Chiefs gets closer to clinching a deal for lasting peace in the Dagbon area. The Asante Hene Otunfo said the second is leading the mediation efforts. And that'll be it for the news. As always, if you want to get interactive, very easy for you to do so. On Facebook, we have a page, Join News on TV, which has a link on our Twitter handle at Join News on TV as well. But on WhatsApp, we have the number through which you can always send us a lot more of your messages. We can see a lot more of them. And the number is 0560 800,000. In the meantime, though, we're taking a break. When we come back, we have a lot more for you, from summarized stories from the newspapers, and they've been summarized on the news portal, myjoyonline.com. We'll also try as much as possible to bring you a lot more of other interesting stories from other news portals on the continent, in our country and across the globe. Do stay on. We're taking a break. When we come back, we'll look at the newspapers.